I'd like to welcome you to the Tobacco Online Policy Seminar Talks. Thank you for joining us today. My name is Tony Lugemwa, Behavioral Health Researcher at Memphis Health Center. TOPS is organized by Michael Pesco at the University of Missouri, Tushang at the Ohio State University, Michael Darden at Johns Hopkins University, Jamie Hatt Boyce at University of Massachusetts Amherst, and Justin White at Boston University. The seminar will be 1 hour with questions from the moderator and discussant. The audience may pose questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on the tobaccopolicy.org website for acceptable questions. Now that's tobaccopolicies.org. And that's where you'll find all acceptable questions. Please keep the questions professional and related to research being discussed. Questions that meet the seminar series guidelines will be shared with the presenter afterwards, even if they are not read aloud. Your questions are very much appreciated. This presentation is being video recorded and will be available along with presentation slides on the TOPS website. That is tobaccopolicy.org. I will turn the presentation over to today's moderator, Tushang from Ohio State University, to introduce our speaker.
Thank you. Today, we continue our summer 2025 season with a grand rounds presentation by Doris Gammon entitled Measuring Changes in Tobacco Product Sales and Availability Following California's Statewide Flavored Tobacco Sales Restriction, a synthetic control method using retail scanner data. This presentation was selected with a competitive review process by submission through the TOPS website. Ms. Gammon is a public health researcher and program manager in RTI Center for Program and Policy Evaluation to advance community health. She earned her master's degree in economics from the University of North Carolina, Charlotte in 2010 and joined RTI that same year. Ms. Gammon has nearly 15 years of experience leveraging scanner data to conduct time series analysis and employ quasi-experimental designs to evaluate public health policy interventions and their intended and unintended outcomes, with a focus on policies intended to reduce the harms associated with tobacco and alcohol marketing and use. She has authored dozens of peer-reviewed manuscripts and conference presentations, and her research has been cited in both proposed and final federal rules by the Food and Drug Administration. Ms. Gammon continues to advance the understanding of how policy interventions influence population health and inform regulatory decision-making. Dr. James Nannymaker, Senior Research Scientist at RTI International, and Morgan Whitney, a Research Public Health Analyst at RTI International, are co-authors of the studies and will answer select questions in the Q&A. Ms. Gammon, thank you for presenting for us today.
Thank you, C, for having me. Thank you, everyone, for joining. I'm gonna get my slides up now. Okay. Okay, I think we're ready to go. So as C said, my name is Doris Gammon, and I'm a public health researcher and program manager at RTI's Center for Program and Policy Evaluation to advance community health. Today, I'm presenting the results from two studies, one that focuses on flavored non-cigarette tobacco product availability, and another that focuses both on the availability and sales of cigarettes before and after SB 793, California's statewide flavored tobacco sales restriction. Both of these studies employed similar data and similar methods, but they cover different time periods and they have different historical context. I'd also like to recognize my co-authors, Morgan Whitney, James Nannymaker, Lisa Henriksen, Nina Schleicher, Elizabeth Anderson Rogers, Rafael Colonna, and Todd Rogers. The research was funded by the California Department of Public Health Tobacco Prevention Program. I don't have any conflicts of interest to disclose, and the only tobacco-related funding that I've received is from federal and state governments. The findings and conclusions in this presentation are those of the authors, and they don't necessarily represent the views or opinions of the California Department of Public Health or the California Health and Human Services Agency. And the authors' own analyses and calculations are based in part on Nielsen IQ retail services data. The conclusions drawn from these data are those of the authors and don't reflect the views of NIQ.
Sorry to interrupt. We still see the black box on your screen.
Oh no, I'm so sorry.
Yeah.
All right, let's try again.
Yep.
Thanks. Are you able to see it?
It's still there, the black box. So do you mind sharing slides rather than the screen?
Oh, someone says they see the slides.
Okay. Oh.
Okay. I'll try one more time through my app here. Is that showing up for you?
Yes, but unfortunately the black box is still there. I think we can continue with this. Yeah.
I hate for it to be a distraction.
Yeah, it's likely the controls for Zoom, Serena said. So see if you can move it. It's probably just like on your Zoom, when your share screen is there. Well, let's try one more time, but if it doesn't work, I think it's okay. I can still see like 90% of the slides.
Oh, I
Yeah.
see what you're seeing now, and I don't understand that. We tested this. Okay, well, I'm gonna go on. Unfortunately, I don't know how to troubleshoot that right now, but the slides will be shared after. Apologies for the technical issue there. So just level setting here, we know that marketing of flavored tobacco targets specific populations. We know that most youth who use tobacco start with flavored products and use them. And most non-Hispanic Black adults who smoke cigarettes use menthol cigarettes. It's approximately 80% compared to all adults who smoke cigarettes. Their menthol use is around 43.4%. So California's statewide law, SB 793, restricts most flavored tobacco product sales and therefore could reduce tobacco use among priority populations if the tobacco products are removed from the marketplace. A little more background. So the policy went into effect on December 21st, 2022, and it prohibits the sales of tobacco products with characterizing flavors, including menthol cigarettes. It does have some exemptions for shisha and 21 and over stores, pipe tobacco, and premium cigars. And it's also important to consider that almost half of California's population already had a flavored tobacco sales restriction of some kind prior to this statewide policy. The California Department of Tax and Fee Administration and the California Department of Public Health began notifying tobacco retailers, distributors, and wholesalers about SB 793 in December 2022 and January 2023 through online notices and direct mailers. Initially, there was a monetary fine of $250 per violation to the seller, and subsequent legislation has increased those fines and developed a different structure. There's also a rebuttable presumption built into the policy such that products can be presumed flavored based on marketing, but it's not limited, including but not limited to a product's name, packaging, and advertising. We also saw, coincident with the implementation and effective date of SB 793, the introduction of new non-menthol cigarettes, many of which were chemically tested and had synthetic cooling agents in them. And noting here that post-dating our study, but subsequent laws have been implemented to further strengthen SB 793. Our research questions for the first study was from before to after SB 793, to what extent did non-cigarette tobacco product availability by flavor category change in California compared to a control area? And we also looked at the extent to which cigarette sales and availability by flavor category changed before and after the policy. To answer these questions, we licensed data from Nielsen IQ for 24 US states, including California. Our pre-intervention period was approximately 23 months, and our post-intervention period for the non-cigarette availability study was approximately 6 months, and for the cigarette availability in cells was approximately 12 months. And the time differences here are just when we were actually doing the study. This was the most recent data we could get. We analyzed information on cigarettes, electronic nicotine delivery systems, or ENDS, cigars, moist snuff, snus, chew, nicotine pouches, and roll your own tobacco. The store types covered by these data include convenience, grocery stores, drugstores, mass merchandisers, warehouse club stores, discount dollar stores, and military retailers. Notably, they don't cover what's happening online or in tobacco specialty stores and smaller format stores not tracked by the data collector. For the non-cigarette availability study, we categorized flavors as either explicit, concept, or unflavored based on the way that Nielsen has coded the flavor descriptor from external product packaging. And for the cigarette study, we categorized flavors as either menthol, non-menthol labeled, or tobacco unflavored. Our outcomes were availability and sales. For availability, we used the Universal Product Code, or UPCs, in the data for every product. Every product has a unique identifier, and it's based on its characteristics, such as brand, sub-brand, flavor, nicotine strength, and size. And we operationalized availability as the number of UPCs with non-zero cells in each week. And availability informs the variety of products available on the market. And for cells, cigarette cells, we standardized units to a single pack of 20 sticks. To conduct this study, we used the synthetic control method. So this is a statistical technique to estimate the effect of an intervention. I broke this down into a 3-step process to share today. So first, we create the synthetic California for each outcome, which becomes our control group. So the way the synthetic control works is that it identifies the optimal combination of untreated states to produce a control group that matches the treatment group as closely as possible in the pre-intervention period. So the algorithm of this method is designed to minimize the root mean squared predicted error when comparing the outcome in the pre-intervention period between the treatment group and the synthetic control group. We ended up with 19 states in the donor pool because we excluded border states and states with flavored tobacco sales restriction at the state level. The goal here was pre-intervention comparability so that we had a matched comparison market, and the predictors for our models were lagged values of the outcome. We also included population as a predictor in the model of cigarette pack sales. So once we had our synthetic controls identified, we were able to go to step 2, which is where we compared actual California to synthetic California. And here, synthetic California is going to give us what would have happened in California had there not been a flavored tobacco sales restriction. And then finally, we moved to placebo models. This is a permutation test where the treatment is randomly assigned. And we estimated models where we iteratively replaced California with each state from the donor pool, and then we re-estimated with California added to the donor pool. We then calculate and we compare the ratio of the root mean squared predicted error in the post and pre periods between the main model, California as the treatment, and placebo models, which we had 19 of. And then the larger the ratio in the California model, the stronger the support of a treatment effect. All right, so now I'm going to jump to the results. So for the first study where we looked at non-cigarette tobacco product availability, let me just see here, is there still a black box? There is, okay. I'm going to jump to these results now. So availability of non-cigarette tobacco products with explicit flavor names decreased in California, as you can see here, at the time of SB 793 going into effect, and there was not a similar decrease in synthetic California. This supports and suggests a policy effect. And just to quantify some of this, ends UPC availability decreased by 65% from about 443 UPCs in the pre-intervention period to 156 UPCs in the post-intervention period. Cigars decreased by about 40%, smokeless tobacco by about 28%, and nicotine pouches availability decreased by about 17%. The placebo results here show that the ratio for the main model was consistently larger than the ratio in the placebo models, in all of the placebo models. And the ratio was relatively large, especially for little cigars and cigarillos and smokeless tobacco. This all supports that this was a policy effect that occurred. Availability of non-cigarette tobacco products that were unflavored in California diverged somewhat from synthetic California after SB 793 went into effect, but not in a consistent direction, and there's not a very big gap there. When we look at the placebo results, we see that there's relatively small ratios in California compared to the placebo range. For little cigars and cigarillos and smokeless tobacco, the ratio in California did exceed that of the placebo range, but they were still relatively small. So we might consider that weak support of a policy effect or a treatment effect. And then for ends, nicotine pouches, and roll your own tobacco, we have, there's really not support here for a treatment effect in changes in unflavored versions of these products. Finally, we looked at availability of non-cigarette tobacco products with concept named flavors in California, and we see that in California, it does diverge somewhat from synthetic California after SB 793 goes into effect, but not, again, in a consistent direction. California availability decreased for ends and cigars, but it increased for smokeless tobacco. When we look at the ratio, the post to pre-RMSPE ratio for the main model, it's not consistently larger than the range of ratios in the placebo models for any of these products, suggesting no treatment effect. So in conclusion, for explicit flavor named products, the policy was associated with reduced availability in the first 6 months following SB 793. There was a lower but notable level of products that remained available. For tobacco unflavored non-cigarette tobacco products, there was no or weak evidence of a policy effect on availability. And for concept flavored products, there was no evidence of a policy effect. And I call out here that average weekly availability of explicit named ends in California decreased by 65%. But in the post-policy period, there were still 156 UPCs with explicit flavor names. All right, I'm going to move on to the results for our cigarette study. So for our analysis of menthol cigarette sales and availability, availability is on the top right panel and sales are on the bottom right panel. Availability and sales of menthol cigarettes in California decreased at the point of intervention, and there was not a similar change observed in synthetic California. Availability decreased by about 44% in California, and pack sales decreased by about 90% in California. For tobacco and unflavored availability and standard pack sales in California, cigarette pack sales in California, we see a small gap in the post-intervention period between California and synthetic California. The relative increase in sales in California compared to synthetic California in the bottom panel there could be the result of some people who were previously using menthol cigarettes switching to tobacco unflavored cigarettes. So that's something to keep in mind. Finally, we looked at non-menthol labeled cigarette availability and sales. We see an immediate and large increase in the availability and pack sales of these products in California, and we don't see a similar change in synthetic California. The availability of these products increased 194%, while pack sales increased 708%. We also noticed that in late 2023, pack sales for these products in California started to go down pretty quickly. And this was driven by a decrease in Camel Crush Oasis, non-menthol Oasis product sales, and was also during the time that litigations were going on between the California OAG and Reynolds Tobacco about the determination that these products were presumptively flavored. We also see, like we did in the non-cigarette availability study, we see that there remains products on the market. They don't go to zero. The placebo results for these outcomes are here, and you can see that the post-pre-RMSPE in California was larger than any of the ratios in the placebo models for each outcome except the tobacco and unflavored cigarette pack sales. The ratio in California was also relatively low for the tobacco unflavored availability in pack sales, while the ratio in California was notably large for non-menthol labeled pack sales. So again, these ones that are underlined are larger than all of the placebo models that were run, and it supports a policy effect. So in conclusion, among menthol cigarettes, the policy was associated with reduced availability in pack sales in the first year following SB 793. And there was a lower but notable level of menthol cigarette availability and sales that remained. For tobacco and unflavored cigarettes, there was weak evidence the policy reduced availability and no change in pack sales. And for non-menthol labeled cigarettes, we see the policy was associated with increased availability in pack sales in the first year following SB 793. This could suggest substitution. We also saw a decrease in sales in late 2023 related to litigation around flavor determination. This study has limitations. It excludes availability in sales in tobacco specialty stores and online, and this could be particularly important when looking at end sales, which often occur in those non-tracked channels. The availability in military commissaries and exchanges can't be parsed out. All of the cells are combined into one number across the store types. So it's important because military retailers are not required to comply with state law. They're under federal jurisdiction. And compliance could be higher than we estimate if the remaining availability is in military retailers. Our measure of availability is defined as any sales of a product over a specified period across the state, and it's unknown if continued availability is from a single store or multiple stores. But with 100% compliance, availability would be zero in state stores. The implications of this study are twofold. Statewide flavored tobacco sales restrictions can be effective policies for substantially reducing the availability and sales of flavored tobacco products. However, enforcement and compliance agencies should be prepared to address avoidance tactics, such as what we saw with the introduction of synthetic coolants. And continued availability and sales of restricted tobacco products limits the intended public health benefits of California's flavor ban law, and it suggests an opportunity for increased retailer education and enhanced enforcement. Finally, I wanted to go over some of the progress that's been made in the state of California to address, to strengthen the original flavored tobacco sales restriction. The first was Assembly Bill 935, which amended the California Stake Act. This became effective in January 2024, and it explicitly permits the local regulation and restrictions of SB 793. These localities and jurisdictions were already allowed to regulate or to enforce this policy, but this just explicitly put that on paper. It also expands the definition of a local retailer to include mobile units, such as vending machines and booths. It creates a tiered penalty system for violations so that they increase with each subsequent violation. And it also clarified the roles of the California Department of Public Health and the Department of Tax and Fee Administration in advancing and strengthening the state flavor law. And more recently, in September of last year, two new bills were signed into law, Assembly Bill 3218 and Senate Bill 1230. Together, these become effective, by the way, January of 2025. So they just became effective. And they together create an unflavored tobacco list, defining products allowed to be sold on the market. And this is to be administered by the State Attorney General's office in California. and it's supposed to go live on or before December 31st, 2025. That's written in the law. These laws also expand and clarify restrictions on delivery and online sales. They update the definition, this is important, of characterizing flavor to include additives that create a cooling sensation. And subsequently, 1 month before this policy was to go into effect, R.J. Reynolds dropped their suit against the AG for the notices of determination that deemed their non-menthol labeled cigarettes as flavored. It also updates the nicotine definition to include synthetic nicotine and nicotine analogs, and it expands and increases fines and penalties, and it expands the enforcement authority. So this was a lot. I have a couple takeaways. So California's law prohibiting sales of flavored tobacco products did successfully reduce the availability and sales of flavored products. But remaining flavored product availability and sales in the first 6 months to 1 year post-policy demonstrate an opportunity for further compliance. California is addressing enhanced compliance with the passage of the subsequent laws we went over to strengthen the policy through increased fines, expanded location coverage, broader flavor and nicotine definitions, and the explicit empowerment of multiple agencies to support enforcement. Our next steps are to study how non-cigarette tobacco product sales changed in addition to the availability that we've done, and to assess the impact of these subsequent laws and to consider their applicability to current or future laws elsewhere. Thank you.
Thank you. So let's see. So I think it's time for our discussion to discuss the paper. Today, our discussant is Dr. Zhongshun Duan, Assistant Professor from Department of Population Health Sciences at Georgia State University School of Public Health. So Dr. Duan, take it from here, and thank you.
Yeah, thanks for inviting me here to be a discussant. And thank you, Doris, for introducing the background, the methodology, and findings of those two very important studies. So the results are very meaningful given that the tobacco industry are really using flavor as a strategy to target youth, young adults, and other priority populations. So I have a few questions today. Most of them are clarifying questions. So one thing I'm curious about is that nearly half of the California's population was already under some local flavored tobacco sales restriction before the SB 793, before the statewide law. So can you elaborate like how the state law was functioning? Or was it more about scaling up or standardizing or closing any potential loopholes or gaps in the local policies? And how should we interpret some marginal and incremental effect of the state policy?
Great questions. So the state policy doesn't preempt any local policies that were already in place. And so if a jurisdiction already had a local flavored tobacco sales restriction that was as strong or stronger than the statewide policy, nothing changed for that jurisdiction. If a locality had a weaker or no local policy, then the state policy would sort of preside over the law there. And we didn't study differential effects across different policy scenarios in this. But that's definitely an interesting question and something to try to get at, is how the state policy might have differentially impacted sales and availability in those local areas.
Right. Yeah. So yeah, and also related to that, so did you observe any regional differences in the impact of the state policy? So for areas with and without prior local flavor restrictions?
Yeah,
during the data
unfortunately,
analysis?
unfortunately, we were using state level data, and so our cells were one number for the state for every product. So we don't have that local variation in this study, in this data set.
Okay, yeah. Yeah, and I also noticed that in the measure session, so in the published articles, so the authors mentioned that So they were using the flavor names from the packaging of the tobacco products to sort of clarify, to classify the products as like concept, explicit, and unflavored. So those three categories. So given that we know that the tobacco companies, they are using different types of marketing strategies. So the language they are using in their packaging and labeling are really ambiguous and sometimes suggestive. So I just wonder how confident are you in the accuracy of the flavor categorization? So based on the packaging only.
Yeah, that's a great question too.
Mm-hmm.
So I think the approach we took was that use the data. So the data say
Mm-hmm.
what was written on the product packaging. So the data vendor sort of they code that from external product packaging. And
Okay.
so we used exactly what they coded to make our determination on if the descriptor itself was explicit in terms of describing what would be defined as a characterizing flavor in the law. Or if it was not characterizing, then it would be concept. And the only reason it would be anything other for us is if it says, like, only says tobacco or general or plain. And then it can vary by whether or not the product has actual tobacco leaf in it. So our coding scheme is a
Mm-hmm.
little bit complicated, but I think to your point about they could name it whatever they could name it tobacco and add flavors for sure. And so are you able to hear me?
Yeah.
Yeah, so they could name it tobacco on the product packaging, but they could add synthetic coolants in there, and we wouldn't know it
Right.
with this
Yeah.
data set. And so the Office of the Attorney General's job is to say, okay, flavor name is one way that we can maybe determine a product is probably flavored, but they can also look at the way a product is advertised and marketed to help make that determination. But this study, of course, is limited to what's written on product packaging and the assumption that if we say it's if they say it's this and that descriptor is a characterizing descriptor, that it has characterizing flavors. So there is a jump there that we have to make.
Yeah. Okay. Yeah. So it's basically coded based on like the information provided by the scanner dataset. Okay, got it.
It is,
Okay.
yeah.
Yeah. So my next question is about the results of those two studies. So for the first study, it's really great to see that the flavor restriction policy really have a substantial impact on the explicit flavored products. As we can see that there's a large reduction of the UPCs compared to before and after the policy went into impact. I'm curious that, so given that there are hundreds of flavored UPCs, they are still available even after the state law went into effect. So what factors do you think are driving this? Is this an issue like slow enforcement or some retailers' confusion or others? And what could be the potential implications for policies and practices?
Yeah, so I think, and this might be related also to our relatively short post-intervention period. So in
Mhm.
the
Right.
non-cigarette tobacco product availability study, we just had 6 months of data. That was all that was available at the time that we licensed the data. And so I think it's probably a lot of jurisdictions trying to get up to speed on what does this mean, and retailers getting up to speed on what does this mean? How do I operationalize this?
Hmm.
Um, is this, are they really enforcing this? And so I think there's probably a learning curve there. And that I would hope with the subsequent legislation and communication that
Hmm.
we would start to see that. And so that's, an empirical question. But for our study, I think I think the short time period is probably working against us in terms of not working against us, but I do think there's this time, it takes time for the communication and the compliance to fully take hold. But from an industry perspective, I don't know what's going on, right? They're still just distributing those products to those stores to be sold. it seems like that's sort of blatantly happening, as opposed to at the retailer level. I think they probably just need more support and time.
Yeah, okay. Yeah, and also one minor question I'm curious about is that, so is there any reason that for the first study, so only the UPC data are used instead of the sales data like the second study? Is there any particular reason for that?
Yeah, I mean, I think we were focused on
Mhm.
availability for that first study, and I think our next
Okay,
step is to look at cells, and
okay.
what
Hmm.
availability can provide us, we think is still really valuable in the sense that it gives us the array of all the products that are on the market and how that's changing week to week. And
Uh-huh.
we might even think of that more as like an industry side component, whereas the cells might be more of a consumer side, the purchase and the amount of purchase. And so that availability measure kind of stands alone in that way, but we definitely want to take a next step and assess the changes in cells like we did in the cigarette study.
Yeah, thank you. That's great. So, yeah, I think now we can sort of switch to the cigarette study. So basically, I think the results of the second study is quite interesting and striking to me too. So we could see that how responsive, how quickly the cigarette industry could respond to the policy change, as we can see a sharp increase and decrease of two types of products, menthol and non-menthol. Yeah, I just wonder is like how should the policymakers address, this type of product substitutions, like the non-menthol cigarettes, sharp increase like that.
Yeah, it's hard to keep up with the industry.
Mm-hmm.
And so I think California is the model state in that they,
Uh-huh.
like we showed at the end of the study, is that they passed subsequent legislation to address that in kind
Mm-hmm.
of record time, for that kind of process. So
Yeah.
I don't know what else you could do, except to just be ready to be nimble to,
Uh-huh.
the loopholes and be ready to respond. And,
Mm-hmm.
I think it's hard though, like getting support for policy change can be an uphill battle. And so I mean, I think there's a lot of possible solutions, but I think the most obvious one to me is what California did, which was to say, well, okay, we're
Mm-hmm.
going to pass new laws. And on top of that, we're going to create this unflavored tobacco list. And right. So,
Right. Yeah, I totally agree with that. Yeah, and also I'm also curious about so during the data analysis, so did you observe any particular brands or products drive the surge in the non-menthol labeled cigarette availability? So any particular brands or products or from particular manufacturers, something like that.
mhm. Yeah. So, I mean, definitely there was the surge in the Camel
Mhm.
non-menthol products, the Oasis.
Okay.
Those were, I think,
Uh-huh.
the first to receive the notices of determination in April of 2023.
Okay.
But there were many others, and the cells are a combination. I don't have all the brands in front of me. That's a great question, though, and
Yeah.
so we might be able to add some more information either in the Q&A, if we have that at our fingertips. I could also email with you afterward about what that looks like.
Yeah, sure. Thank you. Yeah, and I think lastly, my last question is that so it's like so I saw the future studies you want to do you want to conduct in the next step session. So I also wonder beyond the product availability and sales. So do you see any plans for access like the consumer or the individual level impact of the California SB 793? So for example, using survey or consumer panel data, so to explore like how consumer behaviors will change. So particularly among, youth, young adults, and racial ethical minorities and other priority populations that are targeted by the tobacco flavors.
Yeah, I mean, I definitely encourage
Mhm.
everyone to look at across different data sources so that we can come up with, so that we can challenge the independent, each study and compare it to others, replicate this one. Yes, so I think in-store retail observations are
Mhm.
key to complement this work, especially given the holes in like the coverage of scanner data. think we definitely need more data sources out there to explore and look at this. Population survey data, yes. Consumer panel data, yes. So I think, yes, there's a call for that for sure.
Yeah, okay, thank you.
Thank you, Dr. Duan. So audience, please keep your questions coming through the Q&A panel. We look forward to hearing your questions. So I see there are some questions in the Q&A panel. So one from Norbert Schmidt: has there been any study done to evaluate the effect of unintended consequences from the affected population?
So I'm not sure exactly how to answer that question. I accidentally pulled up the chat there. Let's pull that question
So
back
I
up.
I think, you know, in your studies, do you have plans, for example, to study unintended consequences? You're reviewing the literature. What's your takeaway about possible unintended consequences?
Sure. Yeah. I
Yeah.
mean, within our study that we've already done, we can see that the increase in availability in sales of these non-menthol labeled products. It was an unintended consequence, I think, of the policy. But in terms of the population level, with the subsequent legislation, I think there's hope that there will be, you know, less unintended consequences. So if you have follow-up questions on that, I'm happy to answer.
Yeah. Thank you. There's a question from Cheryl Olson. There has been an increase in smoke shops opening near me in Silicon Valley in California in the past 2 years. I don't know what mix of nicotine products or combustible or non-combustible, legal or illegal, they are selling, but demand has clearly not decreased. Have you looked at the changes in the illicit tobacco market?
Yeah, thanks for that question, Cheryl. With this data, no, we haven't looked at that. There are other ways to get at either illicit or illicit purchases, I guess, within the state, which through the in-store retail observations, you can kind of get at whether or not those vape shops are selling these products. There was a recent paper by Arzoom that was just put out in tobacco control with the Stanford team that did survey vape shops around California, near and farther from college campuses, and they found that in about half of stores they were selling flavored disposable vapes. So definitely, I think still room based on those studies and our findings for enhanced compliance. But so those would be considered illicit. Yeah.
Thank you. There's a question from Matthew Stone. You know that Nielsen IQ tracks 312 California commissaries, 261 of which is a very accurate, like they're very detailed numbers, 261 of which reported tobacco sales. Yeah, these outlets are exempt from the statewide flavor ban and may therefore inflate post-policy availability estimates. Have you explored a sensitivity analysis that removes commissary UPC altogether or compares counties with versus without basis to gauge how much the exemption might be masking true retail compliance?
Yeah, so we reached out to Nielsen about this, the data vendor who licensed the data to us, and we asked them, hey, can we get this, the channel of data that we get is sort of like that group of stores I read in the beginning in our methods, our data section. It's the most comprehensive group of cells that we can get in the state, but the limitation is that it includes those commissary cells. And not just commissaries, but naval exchanges and other things, any kind of military retail store. And we asked them, could they parse it out? And they said no. So what I did was I actually started calling commissaries and talking to grocery managers and just trying to get a sense of what kind of tobacco products do you have? What are you selling? So I just called a small sample of them. One sold no tobacco. And then the others sold only limited lines of tobacco, like some didn't sell e-cigarettes. some didn't sell nicotine pouches, some didn't sell cigars. And so it was kind of all over the place. Some did sell cigars, and they sold wine flavored cigars, for instance. So it was an interesting exercise. But what I came away with was that tobacco products are not ubiquitous in the military retailers, but also that we need to look at other ways to ask this question where it's not, where that limitation maybe is more limited or less influential in our study. Great question.
Thank you. Our Mike Pascal has two questions. The first one is, can you tell us anything about which donor states were selected to make up synthetic California? I know that it probably differs based on outcomes, but
yeah, that's a good question. We didn't present that. We could have presented a nice graph on that. We didn't. I don't have that information in front of me, but I'm happy to share that after the call if anyone is interested. Yeah, and it would differ. It does differ by outcome for sure.
Thanks. The second question is, TOPS has had a lot of presentations studying flavor restrictions. Does your study offer any surprising findings or novel insights within the context of the broader literature?
Yeah, I mean, I don't think there's, I mean, I think what this adds is a larger geographic look at what happened with the sort of larger coverage of what happened with the non-menthol labeled products in California. There have been some studies, but not any that have looked sort of statewide at what's going on. And so I'm glad that we're able to provide that to the literature. It wasn't necessarily surprising because we early on saw what was happening in the market. I'll have to think about your question a little more, but yeah.
Thank you. We have more audience questions. So Thomas Wilk is asking, do you know if the Nielsen data include vendors on tribal lands?
That's a great question, and it can. So it depends, and that's something we're working with Nielsen on right now for other studies actually to understand more about. Because if it does, the implication there is that it's another limitation. There is a history of people going to reservations or Indian tribal lands to purchase cigarettes either for cheaper prices or now for getting the flavors that are no longer available in their regular store. So I'm really glad you asked that question, and that's going to stay a priority for us to dig into.
There's another question from Norbert Schmidt. What are vape shops in California supposed to exit on if they restrict themselves to legal products? Have you evaluated how many shops have closed because of this legislation? I know this is a little beyond what you talked about, but is there any evidence or any data that can help answer the questions?
I have a few thoughts. So the ban doesn't restrict all in sales, so they can be tobacco or unflavored. And Justin White is who I'm thinking of about this question because you've done some work on sort of the impact on retailers of these policies, but I don't know if you've done this work for this particular policy and specific to vape shops.
Okay, so no question from Lubasi or Obedi. Have you explored the intersectionality of tobacco control and marginalized groups like gender? I'm just wondering.
Yes, we have done that, but we haven't done that in this study. So this data doesn't lend itself to really person level characteristics. And so we can't really get at that detailed level. It's a really important topic area, but unfortunately we weren't able to get at that with this study.
Thank you. So I have a question regarding the measurement of availability. I'm just wondering, like, how comprehensive does retail scanner data provide in terms of the availability? Because if you think of the market of tobacco, there are vape shops, there are online stores, there are multiple sources where consumers can get their products. So I'm just wondering, and even if that, just looking at the data, sometimes they may not be able to pick up the emerging brands. So I'm just wondering, like, how reliable availability measure is based on the retailer scanner data.
Yeah, I mean, it's within the confines of the store types
Yeah.
that it represents, I would say. And so there absolutely is a gap. We don't know what this means about availability and access online or in non-tracked stores. But among the stores that are tracked, I mean, Nielsen has, I think, I want to say their actual data that they get. So they get data from a slice of stores across the nation, and then they have proprietary projection methods from which they then project what all of those stores are selling. And I think for a lot of them, they can be fairly accurate projections in theory, because for some of their sample, they might get, like, let's say half of the BPs, but the rest they have to project to. But the distribution routes and channels, and I'm just speculating here, the inventory would probably be similar across the different franchises or chains. Now with independents, which they do also get information on independents, I think there's more manual from the Nielsen IQ side. I think there's more manual in-store audits happening. And we know that they're still not capturing everything, even in those stores, but within what they do capture, this is what we see.
Thanks. Question from Kelly Corner. Would you feel comfortable utilizing this study design at a county level versus state?
This design at a county
I
level?
guess synthetic control, that's my understanding.
Yeah, I mean, I think as long as, I mean, I think you do have to consider some of the assumptions of the synthetic control method, so that it's not, like, misused, I suppose. But I think with the right amount of information and data on the different units of analysis, you could absolutely employ the method at a more geographically granular level.
Yeah, I guess that's a very interesting question, because I think that if you want to do a deeper dive into the county level information that Nielsen provides, you can potentially select donor counties from outside California and do a county level analysis, looking at each of the California county and see how the sales change. Just that, I think from methodological perspective, that can be done. I feel it's just, I don't know, there are any pros and cons to go that route versus, conducting analysis at the state level.
Yeah, and I am remembering now, there might be the synthetic control method, at least in the, like, version 1 kind of thing that we're using, is maybe only set up to have a single treatment group. So if you were at the county level and you had multiple treatment groups, you might reconsider that model or see if there's a different version of the synthetic control method that you could run. But I haven't done that, so TBD.
Thanks. Another
There
question
are
from
generalizations of the synthetic control method that have been developed for those types of situations.
Okay.
Thanks, Jim. So a question from Mike Pascal again. Did you use all pre-period time units or select pre-period time units for fitting synthetic California?
So we used all of the data available in the model. So for the selection of the synthetic control, it was all the same time period for every observation or unit or state. So all pre-period time units. I think the answer is yes to your question. Yeah, so we didn't select anything. No, I think it uses what you give it. So the model will use the time period that you give it to make that selection.
Okay.
You can actually choose that, but I'm guessing Morgan could probably speak to this better than I could. I'm assuming we did use all of them. You could use a smaller set, for example, if you thought that for some years prior, there was a reason to not include them because that might introduce differences or something along those lines.
Yeah, sure. There are a lot of consideration about the methods here, so it's very, very interesting. I think I don't see any additional questions in the Q&A panel. So thank you, everyone. So I'll ask our MC to take us out. And for audience who are interested in further discussion, we have top of the tops followed. So yeah, thank you. Tony, please take it away.
Well, we are unfortunately out of time. However, if you are still having any burning questions or thoughts for Ms. Gammon, you can join us for Top of the Tops, an interactive group discussion. To join, please copy the Zoom meeting room URL posted in the chat and switch rooms with us once this event concludes. We'll leave this webinar room open for an extra minute after the end to give everyone a chance to copy the URL, which is bit.ly. That's bit.ly/tops meeting. I'd like to thank you, presenter, moderator, and discussant. Finally, thank you to the audience of 212 people for your participation. Have a top-notch weekend.